Constantly having a fear that you might have a chronic illness? Are you constantly checking on the internet and matching your symptoms with other chronic illness? Are you doing many health checks or body scans? Then you might be having health anxiety. Hey friends, welcome to this education session on Lung Mind channel. I'm Shikila Devi Perumal, a specialist in pulmonary rehab, counseling and psychotherapy. I produce weekly education on mental health and lung health. My mission is to provide free education on mental health and mind health to help people to manage their quality of life in a better way. Today, I'm going to talk on the health anxiety and give you some tips how to rescue yourself and make you aware therapy is available for you and for your health anxiety to be resolved and being supported in your quality of life. Anxiety, also called as hypochondriasis previously. I say previously because in 2013, the DSM, the Diagnostic Statistical Manual of Mental Health 5, has renamed the term health anxiety as Somatic Symptom Disorder because it's the bodily symptoms being misinterpreted and overanalyzed by a person having a health anxiety. Normally, a healthy body produces physical symptoms at times which is uncomfortable, unexpected, painful. But people with health anxiety, for example, a person with cold in this pandemic, imagines that he's having a COVID and he confirms with the home kit test and test kit, sorry, and he confirms the test is negative. But he's having the symptoms. So he's still having this anxiety that it can be COVID and he wants a second confirmation. So he books in an appointment with his doctor to the hospital, and then the hospital, after further tests, confirms the person doesn't have a COVID. But this person, because the symptom persists, doesn't believe the test kit or doesn't believe the diagnosis given by the experts, which is the doctors here, and believes that whatever he is thinking about his symptoms and experiencing the social media ambience of the pandemic and the rates of deaths, he is getting this scenario in his mind that eventually no one can actually identify his symptoms, and whatever he believes COVID is the truth, and then goes home and tries to look into the Google, researching more evidences of the symptoms, and focuses on creating worst case scenario, eventually creating this fear of death. You might eventually die. So, if I could take this analogy of a car has an alarm system. Yeah. And the alarm system exists for a purpose to indicate if there is any break in. But what if the car gives alarm or makes this alarming noise whenever someone passes by the car? For example, the pedestrian. The innocent pedestrians are misinterpreted as criminals. So, this is what the health anxiety person does. The person with health anxiety overanalyzes the situation and creates this worst case scenario in his mind due to his compulsive excessive thinking and excessive overanalyzing of that symptom, whatever he having, or the situation. So as a result, there is a pattern behavior for this person where in is related to this health, making a frequent visit to the doctor's clinic, excessive researching on the internet about his symptoms and relating or cross-matching with other chronic illnesses, and taking multiple medications and compulsive checking and seeking reassurance and frequent body scans. The other extremist actually avoids the doctor, distrusts everything that exists outside, and avoids medication, exercise, media resources, going out, and also blocks all the social interactions or social media contacts in a fear that no one is actually understanding or no one is actually identifying whatever is going through. Now, you can ask me a question. What is generalized anxiety and health anxiety? There is a difference between the two. For example, imagine a person has social anxiety approaching a group of people or a public event. And so this is a danger environment for that person. So the person's brain identifies that the situation of group meeting or a public speaking is a danger, and the brain perceives the signals, and the brain then sends signals to sympathetic activation, and signals then from sympathetic activation activates the endocrine system, and the endocrine system activates the adrenal glands and the cortex, and that increases the adrenaline secretion and the cortisol, which produces the physical symptoms such as shortness of breath, raising heartbeat, muscle tension, tightness in the chest, dizziness, sweating, nausea, and diarrhea, and some shakiness in the body. And there are some other symptoms as well related to anxiety. But once the situation is just removed, when the person is removed from the public event or the group meeting, the person's anxiety is controlled. A generalized anxiety approximately lasts for 30 minutes. But in case of the health anxiety, the person actually is not convinced even if the person is provided the evidence or removed from the situation. The person has exaggerated due to his compulsive thinking of this scenario, and creating a cognitive distortion as the real default mode. The negative cognitive distortions are the real verdict for that particular person, and constantly believes that. So, if you could think about what are the root causes for this anxiety, whether it's the generalized anxiety or the health anxiety, the root cause is intolerance to uncertainty and intolerance to distress. And over exaggerated intolerance to uncertainty and distress is the health anxiety. And if you ask me, what are the causes or precursors for this health anxiety, it can be genetic, and or it can be sometimes a person living with a person who has an health issue for a long term and perceive those symptoms and applying those cognitive uh, those cognitive informations into their mind, and putting themselves describing those symptoms being appealed to them, and they have created this fear mechanism inside them, and that keeps them going with this thought process, and impacts their mental health to a worst case scenario where it actually curtails their potential to engage in a professional or social life. Now, how to stop health anxiety? I'm going to give you 3 steps to stop the health anxiety. The first step is to activate your parasympathetic system, that is the calm and digest system. Because your mind of anxiety mind is activated by the sympathetic system, and then irrational thought process and cognitive distortions are clouded in your mind, where you cannot rationally think and witness even the evidence is produced. So it is about giving a counter mechanism of activating your parasympathetic nervous system. So how do you do this? There are several techniques to activate the parasympathetic nervous system. A few of the things which I can mention now here in this video are breathing techniques. Okay, so the breathing techniques of 3-3 rule might be very helpful. And some of the other parasympathetic activation responses, like having a good social connection, and having a laughter mechanism, having setting of boundaries, healthy boundaries, in terms of what to believe and what not to believe. Those are the self control mechanisms which you can apply. And research has proved that the neurotransmitters of our brain can be improved in doing some yoga and mindfulness. Research has actually proved that 8 weeks of 30 minutes mindfulness of yoga can improve your symptoms of anxiety and depression. So you can give a try on that. And second tip is to trust your body. Okay, so not let your mind to overtake by over exaggerating your symptoms or over analyzing the situation and providing a self diagnosis for yourself. Rather, leave the job to the experts, that is, the doctors or the consultants or the therapist. So let us actually practice some willingness of acceptance and be comfortable to be uncomfortable sometimes, and that would actually help us to protect our mental health for the long run and provide us with a better quality of life. And third tip is approaching counseling and therapy resources. CBT and ACT, acceptance and commitment therapy, are best proved to support health anxiety, as this also forms in one of the obsessive compulsive disorder, there's anxiety. Thought restructuring process and other supportive tools are used in CBT, and ACT uses a diffusion technique and self-concept technique to revive the present process and getting committed to the values rather than focusing on their health anxiety and over exaggerating on the issues, focusing on the values and distracting them from that and connecting them in a more healthier way to invest their energies for a better quality of life. So that closes the session on health anxiety. I would like you to share this video with your loved ones and subscribe the channel for more videos in future for mental health and lung health. Bye for now.